And one thing about the ketogenic diet is we know the side effects. So when you call us, about 95% of the time, we may know. And I say 5% because sometimes you go, we've not heard that, okay? So constipation is a problem because we kind of have to limit somewhat the fluids, and then it's the diet is not really very high in fiber, okay? So we say adequate fluids and then inclusion of vegetables in the diet. So we kind of manage that, okay? We use Miralax or milk of magnesia because that's, constipation is a big deal for kids, right? If they're constipated, they have belly pain, and you don't know as wolf-hirschhorn, is this belly pain, or is this my child, or is this, you're always trying to find the differential diagnosis. Hypoglycemia, that means low glucose, guys, okay? So I see this more on the inpatient side. So a lot of the kids, because they go from eating sugar or carbohydrates, we go from that to no sugar. So we watch out. So there's a protocol. So you guys don't have to worry because most centers will watch that. In fact, sometimes that's one of the reasons why they may stay extra in the hospital is because the sugars are hovering on the low end. So we have to kind of manage that. And then if the sugars are low, we even ask, are they symptomatic? So any of the parents here are diabetics? Raise your hands, no? So if you're a diabetic, you know what you mean when you have low glucose, right? You kind of feel jittery, shaky. So that's the same, it translates to the kids. Okay, they feel they're irritable, they're kind of shaky, so we have to watch out for that. Okay, decreased growth and weight loss, so we've seen that as a side effect, is the growth in kids. So usually we monitor that. The weight is monitored very closely by our team, and then we increase caloric intake if you start to lose weight. Okay, and families will ask us, well, how about this high cholesterol? Is that bad for my child's heart long term? And so far we say no. Okay, so the older families who have been on the ketogenic diet, if they are followed long term, if they're on a very high fat diet, it doesn't translate to in the future you're gonna get heart attacks. When you hit 50, okay? Okay, one of the biggest things I think in your population is kidney stones, and the risk is fairly high, so we monitor this a lot. So you can see, this is sort of a multidisciplinary approach, okay? So I always say in the ketogenic diet, it takes a village. So you've already heard me say dietitian, pharmacist, neurologist. I'm gonna have a team for you guys later. There's so many teams. So sometimes we may even have to involve the nephrologist. Okay. So in smaller centers, it may be hard to do this, or it may be easy because it makes one phone call. So for example, if I have a child on the ketogenic diet and I have a side effect, if I can't get a hold of the nephrologist, if he's not on call, he's out of town, I may have to contact another nephrologist to ask about the side effect. Okay, so again, it takes a kind of a village. Okay, so we try to avoid topiramate or zonisamide in these kids, but if it helps seizure control, it doesn't mean that you cannot be on it. Okay, we do urinalysis and the calcium creatinine ratio, which again, if you have an elevated calcium creatinine ratio, that means that you may have higher risk of developing kidney stones. Okay, and then good fluid intake. We want to make sure you have good fluid intake. We say drink, drink, drink. And then we said in a nonverbal child with unexplained pain, that's one of the things we so in children who have developmental issues, we always, you can't say, Mom, it hurts, or my back hurts, or my belly hurts. So we may have to say, anything that hurts, we may say, go to the emergency room, or I may order a study to rule out like a kidney ultrasound to make sure you're not having side effects, okay? Okay, metabolic acidosis is another side effect because again, ketogenic diet equals ketosis, and that means you may have metabolic acidosis, okay? So again, we try to avoid the two drugs that I was talking about. And then if you have acidosis, we may give you medicines like bicarb. Remember, bicarb is alkaline, and you want to balance that out, so we may add something to obviate this acidosis, okay? So I think Dr. Battaglia earlier alluded to osteopenia. So that is not just in wolf-hirschhorn kids, guys, okay? Osteopenia, like us women above 40, 50, we have to watch out for that. So in kids, our kids, who may be number one if they're wheelchair bound, that you have to kind of watch out for osteopenia. So any of my kids, not just wolf-hirschhorn, if you have CP in your I take care of kids with spasticity. That's part of my baseline. They do what we call DEXA screens to find out if they have osteopenia. So we have, in Nationwide Children's, we even have what we call a bone clinic that's run by endocrinologists and by the rehab doctors and orthopedic doctors. So again, it's multidisciplinary to avoid that. So like what he said, if you're an older seizure medicine, that's something you kind of have to watch out for. It's the osteopenia. So if you have that, we have to, in children with the ketogenic diet, we have to watch out for that, okay? All right. So there's nowadays, in the old days, we had just a traditional ketogenic diet, but now we have what we call the Atkins diet. It's a little bit better. You don't have to be admitted. So sometimes what I've advocated for is sometimes some families who are a little bit afraid, they go, I don't know if I want to go through the ketogenic diet. I may tell my team to go through the Atkins diet first, because you don't need to be admitted, you don't have as much labs. And then if you see some amount of seizure control, then, and the families want more, then we may go into the ketogenic diet. So my Atkins diet is sort of my transition, okay, into the ketogenic diet. Are you guys familiar with the low glycemic index diet? Has anybody heard of that? That's the South Beach diet, okay? So it's the Harvard group. So of course, you know, these big centers, they try to kind of outdo each other. So the Harvard group have developed the low glycemic, so they say it's the quality of the carbs. In the last child neurology meeting last year, both groups presented their data. And the data for the South Beach diet or the low glycemic index diet is just as good as the modified Atkins. My personal opinion at this point, and a very few kids, it doesn't work as well. But you know, as I said, I just have a few kids. Okay, so maybe it's just my kids that doesn't work. But again, anything that's new, it's not as well studied. But that's again alternative therapy. So this is a study, again, Dr. Kossoff, that's one of his kind of specialties, is the modified Atkins diet. And again, this is the good thing about this, is there's not much restriction of the calories, proteins or the fluids, but the carbohydrate intake is limited to 15 to 20 grams. So you still have to do a fair amount of calculating. And the ratio is not as high, it's 1.5 to 2:1. So maybe this may be helpful for the less, like the fairly controlled kids, not the super kids who are having a lot of seizures, okay? The ones who are having, maybe like 5 to 10 a day, you want to get into it, but not as bad, so you may try the modified Atkins diet. And I said here earlier, no fasting or hospital admission required. So it's sort of, you kind of just digging into the diet, okay? How much do you need? You don't need to weigh foods as much, and also can be used long term. Okay, this is the low glycemic index diet. To be honest with you, I'm not as familiar, and our team is not as familiar with the low glycemic index diet. And again, it's sort of like the quality of carbs. I think, you know, I don't know, I've not been on any diet, so it's kind of hard for me to tell, but it says 40 to 60 grams of carbohydrate per day. I think my family's on the low glycemic index diet seem to have trouble kind of monitoring what are the quality of carbs. They're always kind of, is this a good quality carb or bad quality? And I'm like, I don't know. So again, this is more of dietitian driven approach, okay? It allows for some typical no foods such as rye bread, okay? All right. Okay, tube feeding options. So in the past 10 years, we've had the Keto Cow, which is easy. So if you have a child who's tube fed, and they're just young, less than 1 or 2 years of age, they're not into the oral foods yet, this is such a beautiful option, Keto Cow. So I've had a kid, 1 or 2 kids with this. They don't have wolf-hirschhorn, but they had to be G-tube. They cannot swallow anyway. So this kid was like on the 4 or 5 seizure medicines, and we were like, we don't know what to do anymore. So we went on the Keto Cow magic. It went away. Seizures went away. And then there's other things that microlipid and polyglucose powder, some designer formulas. I personally use the Keto Cow, the easiest. Okay, perceived barriers to the diet. they won't like the food. You know, I have one family say, going out to eat is like our like it's a rich ritual. You know, to go out and eat in whatever restaurant, and sometimes it's kind of hard for you to go to a restaurant and everybody else is eating burgers and your child is eating something different. Okay, so maybe this is but I think it's a misconception. When you're having so many seizures, I tell families, well, just try it. If it becomes such an emotional issue, then we can come off of it. Okay, but I think it's worth a try, especially if you're on to your 3rd or 4th or 5th drug already. Okay. We've had some kids who do not drink well, and that is the problem. Is if they get dehydrated, their glucose runs low. So sometimes in between, we may have to use a G-tube for just in case situations when they're not feeling good, and you know, and sometimes if they don't drink enough fluids. And I think a lot of families are afraid to put the tube in at first. But I think once they realize, ooh, this is an easy option. I don't have to fight with my kid to give the medicine. I don't have to fight with my kid to give fluids. You don't have to drink, drink, drink. You know, as a mom, that's what we do all day. Did you eat? Did you eat? Did you drink? So at least if you have a G-tube, it's 2 or 3 less problems. Okay. All right. And again, they said adolescents may not comply with the diet because you know adolescents, especially the ones who are in regular school, they don't want to be different from the rest of the family. So, you know, they don't want to say, well, I have a special diet. They may not like that. Okay. So reasons for discontinuing the diet, I think I talked about that. Fair amount, lack of efficacy, it doesn't work, too much work, then we don't want it, okay? Side effects, I've mentioned to you guys the side effects. And then some of them, I have a kid who steals food. You know, and again, but that's once in a while, so we don't worry about that. Or sometimes this child who steals food, if they have more seizures that day, the mom goes, what did you guys do? You know, and maybe, you know, the child may say, yeah, dad gave me cookies, you know, so dad gets into trouble. Yeah. Okay, so anyways, this is our experience. We've had 85 patients started on the ketogenic diet. 7 to 8 of the kids are on the ketogenic diet, with 6 kids on the modified Atkins and 1 on the low glycemic index diet. This is the breakdown, 54% males and 31 females. So again, this is across the board, guys, okay? So that means this is not wolf-hirschhorn, this is all takers, kids who may have intractable epilepsy for whatever reason, for migrational disorders, for metabolic disorders. So this kind of runs the gamut, okay? Okay. And a fair amount of our kids are between 3 to 6 years of age. Average age is about 5 years, okay? And then the range is 1 month to 17 years of age. We had one kid that we just started on 2 or 3 weeks ago. She was kind of using the, we put her in the ketogenic diet, and the physician, we had one physician, he came from New York and moved to Columbus. He's not as used to the ketogenic diet as probably some of us are, and I think he was upset because the kid was kind of using it, because you know how adolescents are, they have issues, and then she was trying to use that as a control issue. She was pouting and she, you know, upset with the mom, but this mom is sort of the OC side. She, you know, it's a matter of who's gonna win, you know, is it gonna be me or my child? So it was like a control, and of course we're in the middle, you know, so that was kind of interesting for us. Okay, this is the diet thing, as you can see. Okay, remember what I said, guys, in 1994, they had the Dateline NBC. So it went up, and then it went down, and then we're back up again, okay? So, I'm not sure why we have more, but maybe we have more referral patterns or what have you. Okay, so this is our seizure outcome. 54 patients were started on ketogenic diet between 1998 to 2006. 1 year seizure outcome is available for 50 of the patients. 60% are still on the diet. 52% had at least greater than 50% reduction in seizures. 7 had more than 90% reduction in seizures. So again, it's not 30% like the other people, but at least it's, you know, it's there, it's apparent. And then one patient had less than 50% reduction in seizures, but had other benefits like cognition. Okay, so for example, let's just say I have a kid on three drugs, and then I use the ketogenic diet and I have magic response. I may not drop all 3 meds. I may start dropping one of them. Like, you know how you have a drug and you're going, this 1, 2, 3, I ask the families, which one do you think works the least? Okay, and I ask what their opinion is. And then whatever their opinion is, I try to say, okay, well, okay, fine, we'll start dropping the one with that has the least side effects or the least efficacy. Okay, so this is the team. It's a fairly big team. Okay, so there's your dietitian. We use nurse practitioners a lot. Okay, they're sort of like, they kind of drive the clinic actually. A neurologist is there, so there's probably, there's Dr. Carey asked us how many neurologists in our team, and there's anywhere from 15 to 17 neurologists just in Columbus Children's or Nationwide Children's alone. And within that team, there's 3 or 4 who are well versed with the ketogenic diet, so they kind of ask our opinions more. Some of them are, don't use it as much probably because they work with patients with stroke more or neuromuscular, like muscular dystrophy. You're not going to want to ask the opinion of a doctor who specializes in muscular dystrophy about seizures, right? So there's different teams. So not all neurologists are going to be well versed in epilepsy or the ketogenic diet. We have our pharmacist, we have a social worker, secretary who kind of organizes this all, our triage nurses. So we have a team where if Amanda makes a phone call, it may go to what we call the triage nurses. If they can manage it, then they answer. If they cannot, then they go up. I call the food chain. Guys, the food chain, medical students, residents, attending physicians. So that's we call, okay, so triage nurses and then the nurse practitioners. If the nurse practitioners usually ask for our opinion also, what do you think? Is there anything else you need to add? Okay, very important. So you see, patient and family. Okay, so that's a biggest part is the patient and family, and for them to be really invested in this. Okay. Okay, this is actually my last slide, guys. So I think somebody asked me, how does the ketogenic diet work in my kids, specifically for 4P? I think you've had maybe 2 or 3 speakers in the past a couple of days talking about the mechanism of action. So I mentioned earlier, mechanism of action, it makes sense, right? So in the GABA receptors are actually, some of them, they map the GABA BRA2 and GABA BRB1 is mapped very close to where your child's genetic disorder is. Okay, so if there is an effect on the GABA receptor, then maybe this is how it works. Okay, so we have several mechanisms. Again, when you ask the typical doctor, we'll say we don't know how it works. Well, I think we kind of know, we just don't know exactly. Okay, because again, this is sort of what kind of lies out there. But at this point, I think this is sort of an example or maybe a reason as to how the ketogenic diet works in your children with epilepsy. Okay, and so that's it. Okay. You're welcome.